All right. Next, we'll hear from our keynote speaker of the day, Dr. Roberto Barrera from CDC Division of Vector-Borne Diseases Branch in Puerto Rico. If you could please share, I don't know if you could share your video, but if you can, share your video and then your screen, Dr. Barrera.
Dr. Barrera, are you available? There we go.
Okay. Well, thank you for the invitation. I hope that next year we can have this meeting face-to-face and in the following years as well. So the idea of this talk was to see how surveillance tools can help us improve the control of Aedes aegypti. And I'm going to be addressing the topic of Aedes aegypti density thresholds as targets for vector control programs. And I'm also going to refer to the use of surveillance and the tools to understand the variability of Aedes aegypti in space and time and how it changes with socioeconomic levels. So the whole idea is to see how we can improve vector control, or in this case, Aedes aegypti control. As you know, we provide this mosquito all sorts of aquatic habitats, mainly containers, and it's kind of concerning that in the last few years we have seen an increase in the number of cryptic aquatic habitats, such as septic tanks, storms, drains, etc. So we have several tools that we're gonna pass to mention them because I understand that you're familiar with. So we can use immature surveys to determine the presence or the absence of Aedes aegypti in containers and houses, and use these stegomyia indices, the house, the Breton container indices. These were really useful during the eradication campaign because when you're trying to eliminate or eradicate these mosquitoes, you don't need to know how many mosquitoes they are. You just need to know if it's present or not. So present-absence data are really easy to gather. We don't need to know how many mosquitoes like we do need today because we're not trying to eliminate mosquito, but to control. And the purpose is to prevent the transmission of these arboviruses. Now, one important survey is the Pupal surveys because they tell us what containers are the most productive so we can target them. And also what originates these containers, like public service deficiencies, generate lots of water storage containers. So Pupal's surveys are also good because pupal mortality is very small compared to larvae. So if we know how many pupae there are, we know how many adult mosquitoes we're going to have. So the other tool that we can use is the ovitraps. They were also used during the elimination campaign because monitoring eggs is a lot easier to detect the presence of Aedes aegypti than immature surveys. You can deploy many of them. They're not invasive. And sometimes you can use them to track the adult population. Other tools are the electromechanical aspirators, mainly the Procopac and the CDC backpack aspirator. And they allow us to sample resin mosquitoes indoors and outdoors. And we can collect mosquitoes in many different physiological stages. And then we can obtain some measure of absolute population density. Now, we didn't have efficient traps for Aedes aegypti, but only a few years ago. And so the use of these adult mosquito traps allow us now to understand better the dynamics of these mosquitoes. The VG trap is one of them, the electromechanical trap. And they're very useful, very sensitive for Aedes aegypti and Aedes albopictus. Now, there is a number of passive traps that don't use electricity or batteries, like this autocidal gravity ovitrap that we invented at the dengue branch a few years ago. And they mainly capture gravid females. And they're very useful to track the population of Aedes aegypti and also to control the population if you deploy them in enough numbers. Now, there is a variety of other tools that we can use, like the adult exit traps. They're very useful for septic tanks and manholes. And there are other gravity traps, resting traps, etc. So the question is, how can we use these tools to decide whether we're being effective at preventing and controlling epidemics of these arboviruses? And so we may say, well, if there's no arbovirus transmission, maybe we're doing a good job. But it's hard to say because the virus may not be in the area. So another way to know is to determine whether the Aedes aegypti population is below the threshold density. But of course, we need to know what those thresholds are. And then we can use field experiments to demonstrate if the reduction in Aedes aegypti population was enough to prevent transmission. And that's a very important aspect. I'm going to mention that, but it's usually very expensive, but they're very, very useful. So in terms of what is a threshold, there is a principle that says that the introduction of a few infectious individuals into a community of susceptibles will not give rise to an epidemic unless the density of susceptibles or vectors is above a certain critical level. So what is the critical level for Aedes aegypti? Now, determining thresholds is very tricky, it's very difficult because thresholds depend on the virus strain, the vector competence of the population, also on the frequency of virus introductions. If you get lots of virus introductions, you need fewer mosquitoes. The herd immunity of the human population, the temperature, and the protection. If you're protected against mosquito bites, you need more Aedes aegypti to cause outbreaks. But the threshold is going to depend on the surveillance tool that you use. You can use OV traps, immature, sorbate, adult traps. And the opportunities to observe thresholds just by monitoring the population can be tricky, especially in tropical areas where Aedes aegypti density is always above the threshold. So how can you determine the threshold if the mosquito population doesn't go down enough to correlate that with the absence of transmission? So determining thresholds is rather tricky. This is an example of a study that we did in San Juan, Puerto Rico a few years ago. The bars is rainfall, the continuous line is the mosquito population. We were using BG traps for this study. The dashed line is dengue. And then we kind of infer, as I'm going to mention later, that the threshold for transmission for novel arboviruses is one female BG trap, one female per BG trap per day. So it's very low. And if you can see, the population of Aedes aegypti never goes down to one or two female per trap per day. So we have very little opportunity to see, to find out what thresholds are just using observational data. Now, there have been several attempts to develop thresholds for Aedes aegypti and dengue and yellow fever. And, there are several that use the immature indices, like the Breton House Index, Container Index. And there is this study in Brazil that is an observational study, as you can see on the graph to the right. On top, you see rainfall, then follow down is the coverage of vector control, then the house index, and at the bottom, you see the dengue outbreaks. And what this data showed was that when the percentage coverage of control went down, you had an increase in house index, and then you had dengue outbreaks. And they concluded that the threshold was less than 1% of the house index. That means that less than one positive house per every 100 houses, which is really very small. Kind of scary to, and there's consistency with other studies. Now, the problem with immature indices is that, as I mentioned at the beginning, there are many cryptic aquatic habitats today that may lead to an underestimation of the real prevalence of Aedes aegypti. Now, Dr. Dana Fox also developed some models for pupa thresholds. And what we can see in this table is that the number of mosquitoes required to cause transmission decreases with an increase in temperature. And the number of mosquitoes that are required to cause transmission also changes with the herd immunity. So if you have lots of people who are already immune, you need many more Aedes aegypti to cause an outbreak. Now, there's been other thresholds, like for Triatoma dimidiata, for mosquito vectors of Ross River, even for the tolerance to biting by Aedes albopictus. There is this study in Italy at the bottom where they determine the thresholds for every month using eggs per ovitrap per day. That's mainly a function of temperature. So you can see that in September, you need only 3 eggs per ovitrap to be the threshold. But in November, it's already too cold, so you need a lot more mosquitoes. So we had the opportunity in Puerto Rico to sort of observe the density of Aedes aegypti when chikungunya invaded the island in 2014 and Zika in 2016. We had a long-term surveillance neighborhoods. And so we were able to relate not only the density of Aedes aegypti, but we tracked the presence of the viruses in the mosquitoes. As you know, Aedes aegypti doesn't move very far. So if you find the virus in the mosquito, it means that it must have acquired it from local people who were infected. And then we also wanted to determine if the vector control measures that we had in place were effective to reduce the transmission of these viruses. So we were studying 2 neighborhoods that were being treated with AGO traps. Most of the houses had 3 traps per home and 2 nearby untreated neighborhoods. And these results, on the top row, you see 2014 and at the bottom, 2016. And you see the 2 neighborhoods that were treated on the left and the 2 untreated on the right. The bars is rainfall. The continuous line is mosquito density, number of female mosquitoes, gravid females per AGO trap per week. And these graphs are all on the same scale. So you can compare the graph on the left and on the right, you see the differences in mosquito density. And the color bars is the presence of chikungunya in Aedes aegypti. As you can see, we detected chikungunya virus in Aedes aegypti for consecutive weeks, which reflected or were showing that a local outbreak in the residents was happening. We saw the same thing in 2016, and the blue bars is the presence of Zika virus in Aedes aegypti. And so we also were able to get some human samples, and we found that 10% of the residents who spent most of the time in the treated neighborhoods had antibodies against chikungunya, and compared to 50% in communities that did not have treatment. So there's some evidence that there is a protection factor when you lower the density at the point that we were able. And we were able to maintain this density for 8 years without having mosquito outbreaks. So we sort of proposed that a relative density of 2 female mosquitoes per AGO trap per week. And we compared these calibrated AGO traps with BG traps. And that's why I said before that it's equivalent to having 1 female Aedes aegypti per BG trap per day. Now, we don't know what the threshold density for dengue viruses is in Puerto Rico because dengue has been endemic in Puerto Rico for many years. And therefore, there is some herd immunity that has been built up over the decades So possibly the threshold density for dengue is higher than 2. But we don't know. We need to establish that because dengue is a recurrent, infection in Puerto Rico and everywhere else. So determining thresholds are important as targets for mosquito control programs because then you know if you are below or above and whether the populations are at risk for transmission. Now, the other elements that I like to talk about on the use of surveillance tools is to try to understand better the spatial dispersal of Aedes aegypti because their distribution in space is heterogeneous or aggregated. And that means that you're going to find hotspots or neighborhoods that are hotspots, not only for in terms of mosquito density, but also in terms of transmission of arboviruses. Identifying those hotspots is critical to the success of a vector control program that is aimed at preventing outbreaks. The other important component is that we need to understand how populations of Aedes aegypti fluctuate in time, both in the intra-annual or seasonal pattern and the inter-annual climate variability. And of course, storms are also a very important event, but we more or less know when they happen so we can prepare. Now, in terms of space, this is a depiction of hotspots in a city. Then there are neighborhoods that are cool spots, means that you don't have that much transmission, not that many mosquitoes, and the cold spots. So what happens is most likely that these hotspots are places where you have sustained conditions for high productivity of mosquitoes, high transmission, and mosquitoes and viruses are being exported for these hotspots to other neighborhoods where conditions are not so good, but nevertheless, there is some transmission or cases are being referred to those places. So the idea or the hypothesis will be that if we can identify and be effective at treating Aedes aegypti, these hotspots, you're going to see a simultaneous reduction everywhere else in the city without having to spend a lot of resources in those areas. So in terms of intra-annual fluctuations, we know that dengue is seasonal, and so are the mosquito populations. So we need to understand this cycle and try to implement preemptive vector control measures because epidemics take several months to mount. But we don't see that. We don't see when the epidemics are brewing. We only see when they outbreak. But early intervention, early in the year, several months before the typical peak, will be one way to, and if you combine these early interventions with the hotspots, then we increase the probability to be successful. Now we have observed, like many others, that inter-annual climate variations such as El Nino, La Nina, North Atlantic oscillation, these are atmospheric events that cycle in different cycle lengths, like El Nino from 3 to 5 years, the North Atlantic oscillation in the scale of decades. And so in the Caribbean and in Puerto Rico, we have seen that El Nino causes anomalous higher temperatures in winter. And what that means is that you don't have the break that you usually have of a lower transmission and lower mosquito density. And I don't have time to go through all the details, but this can be anticipated. In this case, the largest dengue epidemic in Puerto Rico ever was a combination of a very strong El Nino in 2009 and a very strong negative North Atlantic oscillation. And what this causes is an excess rainfall. So during the warmer and wetter parts of the year, you get this huge outbreak. And lastly, we also need to consider the impact socioeconomic factors. We have recently seen that low socioeconomic neighborhoods in Puerto Rico produce significantly more Aedes aegypti in many types of containers, as you see on the right figure. And we can get data about this from the census tracts, so we can stratify the environment also in terms of socioeconomic levels. So in conclusion, I think I ran out of time, is that we need to pay more attention to these thresholds to determine whether we have been effective at preventing these outbreaks and we're effective in our vector control measures, and then understand the variability and take advantage of that variability, the concentration of disease and mosquitoes in some areas, sometimes of the year, with the idea to be more efficient at vector control. Well, thank you, Caroline.
Thank you so much, Dr. Barrera. We'll now take questions for you, and I'll hand it over to Dr. Roundy.
Thank you, Caroline, and thank you for that presentation. Are there any questions for our keynote speaker? Looks like we have a question from Dr. Weaver.
Good morning, Roberta. Thanks for that wonderful overview. Could you expand a little bit more about cryptic larval habitats for Aedes aegypti? Not only what you found in Puerto Rico, but what kind of habitats have been identified in other parts of the world, and any new methods to try to improve the ability to find these larval habitats?
Yeah, thank you. Thank you, Scott, for the question. Cryptic aquatic habitats have been found in storm drains mainly, but also in manholes, in mines. There is a variety of, and also above ground, the rain gutters that are not usually inspected, the accumulation of water on roofs. There's a variety of new environments, and we need to develop special tools to try to find these habitats, because by the nature that they're cryptic, we cannot see them. And this may be very important. For example, we found a single septic tank in Puerto Rico that was producing 1,500 Aedes aegypti adults per day. And up until we discovered that, nobody knew that, Aedes aegypti was being produced underground in Puerto Rico. And that can certainly make your vector control ineffective, totally ineffective, because you're treating containers on the surface and you ignore the presence of these containers. There is a variety of ways that we can understand. The simplest one is the exit traps that we can place and see whether there are mosquitoes going out. We've been trying to understand also the microbiota of the habitats and the microbiota of the mosquitoes. Because if we can find microorganisms that are present in the water of a specific cryptic aquatic habitat, and also in the adult mosquito, so simply by sampling the adult mosquitoes, we can relate to where the mosquito came from. So that's one way of, we've been trying to work on that, and it hasn't been easy because we don't know that much about the microbiome of these aquatic habitats and Aedes aegypti.
Thanks.
I think we have our next question from Dr. Gabe Hamer.
Yeah, thank you, Roberto. I love the topic you covered. So in your introduction, you did a nice job of covering this concept of threshold that can be dynamic in both space and time. And, with regard to temporal variation, temperature in some cases can make a difference. You presented a study on that topic. And then, of course, herd immunity. So on those two kind of factors, what do you think about your Puerto Rico context? You know, maybe your seasonality and temperature is less of an issue there compared to elsewhere in the world, but then also you haven't touched too much on how herd immunity might vary in Puerto Rico. So what's your thoughts on those two topics?
Yeah, thank you, Gabe. Well, you see, in tropical areas where dengue and these other viruses are the most important, the fluctuation in temperature, according to the models that Dana folks produce, there's not going to be such a huge change in the threshold. Maybe you go from 1 mosquito to 2 mosquitoes. So I'm not quite concerned about temperature in lowland tropical areas. They're more important tropical and temperate areas that need to be considered, definitely. And in the case of dengue, because herd immunity is probably very high, the threshold that we would expect is higher than 2 mosquitoes per aegypti trap per week. But we don't know, and we're trying to conduct a field experiment that has been funded by DOD, where we're going to try to control the density of Aedes aegypti at different levels, and then determine what is the density that causes local transmission of dengue. It's not going to be easy, but it's difficult to find out thresholds without experimentation.
Thanks.
Looks like we have time for 2 more quick questions in the chat. We have a question from Dr. Patricia Pietrantonio. She asks, what is the level of resistance of these populations?
The level of resistance of Aedes aegypti in Puerto Rico, I take, is very high. They are resistant to almost other pyrethroids that you can use that have been approved for use. The resistance to malathion is a little less, and there is a total susceptibility to gnatid. But for the pyrethroids, they're virtually useless in Puerto Rico.
Thank you.
And we have a question from Dr. Jose Estrada. He asks if you're using remote sensing or drones to locate cryptic habitats. How do you feel about using such tools for surveillance and the location of aquatic habitats for treatment? And I think for time, this will be our last question.
Yeah, thank you, Jose. Thank you for the question. Well, you can use drones to locate aquatic habitats that can be seen from the air, like on roof, and roof gutters. And you can also make some assessment of what is on the backyards using drones. I think that's a tool that we need to use more, and I think it's going to be very useful for quick inspections of backyards. So that I see a future in the use of drones, with the limitations of flying drones in urban areas and the liability that you may be exposed to if these drones fall on somebody's head, as we understand. But yeah, I see a future for this. And the last thing I would like to say is that, one asks this question, why Aedes aegypti is so difficult to control, why these arbovirus epidemics keep happening in spite of all the efforts. When you look at the thresholds, the number of mosquitoes, they're very, very small. That tells you that Aedes aegypti is very efficient at transmitting these arboviruses at very, very low densities. So don't be surprised that if you find your thresholds to be very, very small, near levels of elimination. And that, it's not good news, but that's what seems to happen. Over.